Hi everyone, this is Dr. Bhargaw, your head and neck cancer and ENT surgeon. I generally get asked what is thyroid and what are the problems associated with thyroid. Let me tell you in a brief. Thyroid is a gland, an endocrine gland which is situated in the neck. Generally, the problems associated with thyroid are classified into two parts, either functional or structural. The functional problems are usually referred to as hyperthyroidism or hypothyroidism, which means either the gland is working more to produce more hormone than required for the body, or hypothyroidism, which refers to a condition where the gland doesn't produce enough hormone to sustain for the body's needs. What is hyperthyroidism? It's a condition where there is excess production of thyroid hormone from the thyroid gland than what is required by the body. The symptoms of hyperthyroidism include unexplained weight loss, palpitations, that is feeling of your own heartbeat, excessive sweating, increased appetite, lack of sleep, irritability, muscle weakness, menstrual changes in women, and in extreme cases you can have exophthalmos. That means the eyeballs tries to protrude out of your orbital sockets. The most common cause of hyperthyroidism is called Graves' disease, which is a kind of an autoimmune disease of the body. Autoimmune disease is nothing but production of antibodies against its own cells by its own body. The other causes of hyperthyroidism include hyperfunctioning thyroid nodule, that is a nodule in the thyroid producing more and more hormone than what it is required, thyroiditis, which is a kind of an inflammation of the thyroid gland, and in certain conditions where there is excess intake of iodine, which also leads to hyperthyroidism. Prompt diagnosis of hyperthyroidism is mandatory and absolutely required to avoid life-threatening complications. How is hyperthyroidism treated? Anti-thyroid medicines. These help in reduce the production of the thyroid hormone, as well as they are the first line treatment. Second is radioactive iodine. Radioactive iodine therapy. This is the kind of a treatment which is given in the form of a liquid where radioactive iodine material is given to the patient, which kills the thyroid tissue, hence reducing the thyroid production. Beta blockers. These help in reducing the excess heartbeat due to the side effect of excess production of the thyroid hormone, as well as they reduce the tremors. But to cure the hyperthyroidism, the only modality which gives a 100% result is surgical removal of thyroid gland and then followed by replacement of thyroid hormone. Have you ever wondered what happens to an untreated case of hyperthyroidism? Due to excess production of thyroid hormone, there is excessive cardiac output and high heart rate, which leads to the risk of cardiac failure. Osteoporosis. There is depletion of calcium mineral from the bones, which leads to increased risk of fracture, especially during postmenopausal period. Thyroid storm. Excess production of thyroid hormone leads to fever, irritability, and a life-threatening situation. Due to increased thyroid hormone, there can be a risk of miscarriage or preterm delivery and complications related to both mother as well as child. Mental health problems like irritability, mood swings, and lack of sleep. Eye complications. In extreme case of goiter disease, there can be protrusion of eyeballs from the eye sockets, which can lead to damage to the eyeball and the vision. Do you want to prevent hyperthyroidism? Here we go. Maintain adequate iodine intake. Iodine is a kind of element which is present in our foods, especially in salts. Regular health checkups. This can lead to immediate diagnosis of hyperthyroidism in a seemingly normal patient. Stress. This is one of the factors that impact the thyroid function. Doing yoga and reducing your stress can lead to prevention of hyperthyroidism. Smoking. This is not only a risk factor for hyperthyroidism, it also a risk factor for other problems like cardiac problems, cancers. If you have a family history of hyperthyroidism, please do let your doctor know to evaluate your thyroid function. Although all the risk factors are not under your control, a healthy lifestyle and a good diet can prevent you from getting hyperthyroidism. It's a condition in which the thyroid hormone is underproduced than what it is required by the body. This is commonly found in females. Features include unexplained weight gain, cold and dry skin, muscle weakness, hair loss, hoarseness of voice, puffy face, depression, memory problems, and in women, irregularities in menstruation, decreased heart rate, and increased cholesterol. And it is one of the most missed diagnoses as the symptoms are very vague. Wanna know what causes hypothyroidism? The most common cause is iodine deficiency, that is, less intake of iodine in your diet. Second is autoimmune disease called as Hashimoto's thyroiditis, where your body tries to kill your own thyroid. A less known causes would be exposure to radioactive iodine, which causes damage to your thyroid gland, or congenital hypothyroidism, which is low hypothyroid from the birth, or some kind of viral infections can also cause hypothyroidism. Certain medications like lithium can also cause hypothyroidism. Diagnosis of hypothyroidism is very important and critical. Diagnosis of hypothyroidism is very tricky. Prompt treatment is absolutely necessary, which includes thyroid hormone replacement. The risks of hypothyroidism are very grave. Primarily, cardiovascular complications include high cholesterol, which leads to block of the arteries of the heart, which can lead to cardiac failure. The lack of thyroid hormone causes mental health problems like depression, anxiety, and decreased cognitive functions. In women, can lead to irregularity in menstruation, as well as pregnancy complications like preterm births, as well as immature babies. In pregnancies, it can cause high risk of preeclampsia or preterm births. Myxedema. It can cause a severe life-threatening condition where there is extreme fatigue, low blood pressure, and unconsciousness. Goiter. In some cases, there is huge enlargement of thyroid gland, which can lead to compression of the airway and many other problems. Peripheral neuropathy. This is nothing but tingling sensation in all your extremities, which is caused by decreased hormone. Do you know the minerals that help you prevent getting any thyroid problems? We'll start with selenium. It's an important element in production of thyroid hormone, and it also acts as antioxidant. Zinc. It's a very important compound in converting the T3 to T4, which is the active ingredient of thyroid hormone. Iodine. As you all know, iodine is the most important element in the thyroid hormone, and the deficiency of it will definitely cause thyroid issue. B12. Vitamin B12 is not only important for your overall bodily functions, but also important for your thyroid gland. Magnesium is another important element for not only just thyroid issues, but also for your sleep and other bodily functions. If you are on thyroid medications already, make sure there is a 2-hour delay between your food intake and thyroid medication intake. Make sure you maintain correct dose and take it on time every day without forgetting. Do you want to prevent getting any thyroid problems? So follow my advice. Get enough iodine in your food, especially by consuming iodine salt provided by the government and other private players. Maintain a healthy lifestyle and decrease your stress. This is one of the most important causes of thyroid problems these days. Smoking. Avoid it as much as possible to get a better health, not just the thyroid problems, but also to avoid cancers. Get enough sleep, a minimum of 7 to 8 hours. A regular exercise of 30 minutes in a day can prevent you not only just the thyroid problems, but many other problems in your life. And do get regular checkups from your physician or ENT surgeon near you, so that we can diagnose your problem in early stages if at all there is a problem, and cure you of that disease. Don't forget to share this to the person in need of this information.